So
Which is better?
Which is better? Okay. So any kind of replacement that you are going to do for missing teeth is called as a prosthesis. So that is how you call it. And the prosthesis can be divided into either fixed prosthesis or removable prosthesis. Removable prosthesis is where the patient can remove the process, and generally it's like dentures. You call it loosely as dentures, where you remove it and you can keep it in water and then you can wear it again as and when the need is. So that's what is called as a removable prosthesis. A fixed process is where the patient is not able to remove it. Okay, so if it is a fixed bridge or a implant supported prosthesis where the patient is not able to remove it, then it's called as a fixed process. So when you consider the functionality in terms of, we have to have multiple dimensions in the way we evaluate these processes. For somebody who is very elderly, for example, somebody who is 85, 90 years of age and who is not in a situation where they can take up certain amount of complicated restorative or complicated dental work, then we stick to something minimalistic where it is removable prosthesis that we give, just because of convenience, that yes, it can be very easily removed, it can be cleaned by a caregiver, it can be inserted by a caregiver, because fixed process also comes with a lot of benefits, like the functionality improves very drastically. If you're able to apply a force of say 100 on natural teeth, with fixed process you're able to apply almost about 90, which means to say a fixed process is something which is as close to natural as possible. It also comes with some drawbacks, that sometimes the work is complicated, in the sense the kind of restorative work that you have to do on patient is a little more elaborate, which the patient may or may not be able to sit through. And also when it comes to cleaning and certain aspects of maintenance, it is more intense, because of course there is some kind of a device in the mouth and which is always fixed. So the maintenance also becomes even more important in a fixed process. So there are advantages and disadvantages, but purely when it comes to functionality, I think fixed process will score much higher over removable processes. Removable process is inferior compared to the fixed process in terms of the bite force, in terms of the comfort levels and things like that, but there are other advantages. So some of the examples of fixed process, it's called as a bridge when you have a single missing tooth, when you grind the two adjacent teeth and when you make a fixed processes, this is called as a bridge. It can also be implant supported bridge, where you have 3 or 4 implants and you replace about 4 or 5 missing teeth. That's also a possibility called as a fixed process. In dentures, you can have a partial denture where you have some missing teeth, or you can have a full denture where you have all missing teeth. So that's essentially the difference between fixed and removable prosthesis.
Thank you, sir.